Okay, all right guys, so how you doing? So we have a patient over here. He's complaining about low back pain, and this problem's been going on since he was a kid. So we're talking about like the past 30 years or so, is that correct?
Yeah.
Right? Now, it flares up whenever he lifts something very heavy. And in addition to, he does have left sciatica starting from here, going straight down to the mid calf. And it flares up for, again, once in a while, and it's also very mild. So let's go ahead, let's take a closer look, see what's going on. So as we're scanning his spine, right now nothing's really showing up. But then again, this is the first pass. We don't put any weight onto the first pass itself. It's multiple passes, that's what we're concerned about. So as we see right now, there is nothing showing up. All these small little nuances you see, guys, right now are the muscle heat. We're not concerned about the muscle heat. We're concerned about heat given off at a particular level with a structural abnormality due to inflammation. And as we see, there is indication right at that level. There's some elevation there, but not really. Upon visualization and a closer look, because this is a chronic problem that's been there for the past 30-something years or so, it would not be surprising that the edema is also chronic as well. So when we take a closer look, palpate, we have some very small remnant of a small little speed bump right over here. Is that tendon right there? Not really, right? Which is interesting enough, it feels like a little depression going on right here at this fifth lumbar. And we don't really have much of edema, very small amount right between the sacrum and the fifth lumbar spinous process right over here. So we're going to take a closer look, see what's going on. So we have muscle spasms protecting on both sides of this joint over here. So now what we're feeling at the moment is his left side, the sacrum on this side is not moving too well. Now because he mentioned a slight little left sciatica that's coming from time to time, that's why we're focusing more on that fifth lumbar nerve region. See what's going on in that area, either that or the pelvic foundation. Now we're going to take a closer look at this fifth lumbar over here. How's that for you?
No pain.
No pain, right? But here's an interesting thing about it. This one feels a little more forward than it's supposed to be. And it's and there's a little depression here, which is not typical. So let's take a look at the x-ray to see what's going on. So when I take a look at your structural x-ray over here, now as we see right off the bat, when we take a look at normal, it's supposed to be nice and straight. Over here, how does that look like to you?
A little bit like tilted.
So we got this going on this way, curves this way, curves that way, and then curves again this way.
Yeah.
So what is going on? Right? So that tells us there's something going on. And when we take a look for where is centered, where is also leveled, meaning I don't want to see rotate to the left, right, tilt to the left, or tilt to the right. Is it anything centered or level? Nothing. Keep on going, even the pelvic foundation, it's not there either. Because your whole entire pelvis, what you're doing is this way. So when I take a closer look in this region over here, and also that's happens to be the area where your back pain is producing, in a more closer look, I see this little lucency over here. And the way the structure is, this is the fifth lumbar. That's the one we checked on you. And there's a reason why that bone feels a little more depressed inwards than the other, because this bone is fractured. Right? Meaning, this is moderate lumbar spine over here. We need to have this bony structure over here. In your case, it completely broke off.
Okay.
On both sides. On your left side and your right side.
Mm-hmm.
So as a result, this whole entire component over here is slipped forward. So that's what we're seeing over here. It slipped forward by a couple millimeters. And we could see this is the break right here.
Okay.
Right in that spot. If we say this ball is like the disc, and this is the rest of your spine over here, and as we see, as long as we have all the bony structures intact and in place, it's holding this disc in proper position. All the structures are properly balanced above as well. However, because it's fractured and you don't have the bony structure holding this disc and also the structures above it properly in place, what happens? It topples over. So that's why in your case, there is nothing holding this thing in place. Only thing that's left, now correction, the bony structures is no longer there. The only thing you have left is ligaments and muscles. So therefore, there is one strategy what we could do to help stabilize this. Now, in order to help with this fifth lumbar, that's a done deal. That's fractured. There's no way to repair that fellow or stabilize. We can indirectly stabilize by doing this. Your foundation, because the fifth lumbar went forward, we could also push this foundation a little forward as well to meet it up as much as possible. That'll provide some stability towards this fifth lumbar. Another way to put it, I would like to see this stay right here on the table. However, your bony structure went a little bit off and it's wobbling. What we can do is move the whole entire table underneath so it's a lot like this as much as possible.
Yeah.
Addition component, what you have to do, you're going to start working out your lower cores. Because again, ligaments and muscles are the only thing that's holding that fifth lumbar and the rest of your structures in place.
What kind of exercise can I do?
Oh, hey, that's a great question. Now the honest answer is this. Every person's, because the way they acquire that particular type of fracture is going to be unique from person to person. Therefore, I don't know exactly what exercises will be beneficial or detrimental for you. You need to experiment. For some people, when they do sit-ups and crunches, it helps. For other people, it makes them worse. So you got to experiment. So in other words, if it makes you feel stronger and better, hey, that's a keeper. If it makes you worse, obviously, we got to stop. Right?
Okay.
So what exercise you could try? Sit-ups, crunches, planks, leg raises. Give those a try, see how it comes about.
Thank you.
Relax this over here. A little more. A little more. A little more. What's different now?
Feels kind of different. Like I don't feel like the pain that used to go over here. You know, like I don't feel it that much. Like it's like something is missing.
Now we do a post instrumentation after every correction because we want to see what kind of changes there are. Just because we heard a noise coming out from the correction itself, I'm not concerned about that. I'm more concerned about, do we clear the obstruction to this nerve system and allow it to function properly again? And as we see over here, the heat reading has went down. So that tells us we've done our job, restored the nerve function, and this structure in this region over here is going to start healing again and operating the way it's supposed to be doing. How's this now?
Pain.
No pain, huh? How's that? Not too bad?
No.
See, over here, it's not as depressed. As in other words, it's not as forward in as it was before. You feel that difference right there?
Yeah, kind of. Yeah.
A little bit, right? I understand that. This is chronic, this is old, not too evident. So, what we do is, we're going to follow up on a future visit, take a look, see how all that structure is holding up.
Yeah.
Right.